the highly urbanized city category, this was awarded to the city of Davao, led by then Honorable Mayor Sara Z. Duterte, now the Vice President and Secretary of Education of the Philippines, for the Davao Nutrition Program. The health of the Davaoenos remains a priority of the city government of Davao, as health is the right of every individual. The city understands that the healthier the constituents, the more effective the workforce, and everything else follows as a ripple effect. Hence, the city continues to strive to strengthen its community health and nutrition programs. Through this program, the city ensures that no child is left behind through the prevention of malnutrition and the improvement of their quality of life as constituents of the city. Among the exemplary activities or projects done by the city through the nutrition program are the case findings through anthropometric measures, treatment and management of children aged 0 to 59 months, feeding, distribution of vitamin A, and deworming, activation of the Barangay Nutrition Committee who are responsible for delivering nutrition services and other related activities, and the integration with other government and non-government organizations in delivering the program. All these provide evidence-based nutrition-specific interventions and actions that integrate responsive caregiving and early stimulation in a safe and protective environment over the first 1,000 days of life, as recommended by the United Nations International Children's Emergency Fund and the World Health Organization. Other implemented initiatives involve nutrition-sensitive mechanisms, strategies, and approaches in delivering programs and projects that will improve the city's overall nutritional status and eradicate malnutrition and hunger. The city made sure to have an explicit focus on addressing child malnutrition in all its forms and a deliberate emphasis on improving diets, services, and practices. The program was made highly sustainable and reliable through the establishment of the Barangay Nutrition Committee in all barangays, with an appropriated annual budget to ensure that all sub-programs are well implemented. There was overwhelming support for the City Nutrition Council Interagency Partnership and the adaptation of the National Nutrition Council Nutrition Impact Program and the Nutrition-Specific Programs and Nutrition-Sensitive Program. The city sets the indicators according to the SMART, specific, measurable, available, and time-bound criteria. The performance indicator of the project was its effectiveness in managing acute malnutrition. Children are monitored weekly, and officials take note of the rate of weight gain and length of stay in the hospital if any child is admitted due to complications. This was done so performance indicators or learning outcomes could be noted regarding the management of acute malnutrition. The nutrition program, given its strong implementation, resulted in a 15% and 29% reduction in severely acute malnutrition and moderate acute malnutrition, respectively, in 2021. Thus, this indicates a reduction in the prevalence rate of malnutrition in the city through the improved status and physical activities of children 0 to 59 months old. The said programs ultimately aim to achieve a low to zero malnutrition prevalence rate in the city. As a result, children are increasing their productivity, and the city has achieved low morbidity and mortality rates for people below 5 years of age. These nourished children have boosted their immune systems and advanced their motor and cognitive development, becoming valuable members of the city of Davao.